Okay, welcome everyone, and welcome to the RaCEEs course. I'm Valerio Benedetto. I'm a research fellow at UCLan, and I'm also part of the MIDAS team, which is the methodological team in the ARC West Coast. And today is our first session, and I'm running this session with Cath Harris from UCLan. Cath, would you like to introduce yourself as well?
I'm Cath Harris. I'm an information specialist and I work at UCLan and for the MIDAS team with Valerio.
Oh, thank you, Cath. So just as a reminder, as you know, this session will be recorded and we will make the recording available on the ARC West Coast YouTube channel. If you have any questions about the recording, please let us know. We're going to start this session talking a bit about the RaCEEs structure and content, and then we will spend some minutes introducing ourselves as well, and then we will actually talk about the content of session one in the second part of today's session. So let's make a start. I'll talk about the aims of the RaCEEs. Now, you joined the RaCEEs course, so you are more or less familiar with what we're trying to achieve with this course, but it's good to refresh our memory about the aims of this course. So we got three aims. The first one is to grow skills in health economics and health economic evaluation is specifically within the ARC West Coast. So that's our first aim. Secondly, we are going to critically appraise an economic evaluation to inform change in policy and practice. And when we're talking about critical appraisal, this is something we're going to do together. So you, the team participants, the team leads will work together in order to critically appraise an existing economic evaluation. The third aim is to build on this critical appraisal and co-produce and disseminate a publishable commentary centered on the interpretation of an economic evaluation. So our hope is that by the end of the course, we will have a publishable commentary, and then in the weeks following the end of the course, we will be in a position to submit this commentary to a journal. Now, I'm going to talk about the content a bit more now. So let me admit some of the participants in. There we go. So today's first session, and we will talk about formulating a research question and selecting an economic evaluation. And then from session number 2, we will talk a bit more in detail about the characteristics of an economic evaluation. So things to look out for when we read an economic evaluation paper. In particular, we will talk about the key elements, key attributes of an economic evaluation. And then with session 3, we will talk a bit more about costs. Session 4, we will focus on outcomes. Session 5, instead, we will cover the results section of an economic evaluation. So we will talk about how to read tables and graphs, for example. And then in session 6, we will talk about how to write up the introduction section of our commentary. We are going to give you some info about the workshop, which will be the last, let's say, session of our course. And then if you have any outstanding questions, we can discuss them during session 6. I would say the most important bit of this course is the workshop. We haven't got a date yet for the workshop. It will be in early March 2025, though. And during the workshop, we will work on the commentary. So we will work on the critical appraisal of the economic evaluation, and we will try to formulate together some implication for policy and practice. And that workshop is the only bit that is face-to-face, but we are going to strongly recommend that you can make some time to attend that workshop, and we will share the date as soon as we can with you for that workshop in early March 2025. As you know, we got 6 online sessions, and this is our calendar, and then the last workshop will be face-to-face in early March. Okay. Now, These are the teams. So each one of you will have selected some topics of interest at the beginning when you register for this course. The team leads went through the registration forms and tried to allocate you to a team or a topic, let's say, that we consider would be suitable for your interests. And we came up with 5 teams, and each team is led by a team lead. And I'm gonna list you the teams now in this slide. Team number 5 is music therapy, and team number 6 is housing. Team number 7 is maternal and neonatal care. Team number 8 is acute healthcare, and team number 9 is young people care. Now, the numeration, we are starting with 5 because we already had 4 teams in the previous RaCEEs course. So in order to avoid confusion, we wanted to start with number 5 here. I'm going to introduce you to the team leads now, and then we will spend some minutes, actually you will have some minutes to introduce yourself as well. So for music therapy, the team lead is Cath, Cath Harris, and then for team 6, housing, the team lead is Andy Clegg. I think Andy, you joined us, so would you like to introduce yourself?
Yeah, sure. Hi, I'm Andy Clegg. I work at the University of Central Lancashire, and I'm the theme lead for MIDAS.
Thank you very much, Andy. Team 7, maternal and neonatal care, Luis.
Hello, my name is Luis Filipe. I'm a lecturer in health economics at Lancaster University. I was before part of the ARC as well. And yes, I'm glad to have you here.
Thank you very much, Luis. Team number 8 is acute healthcare, and it will be led by Mizel.
Hello, hi everybody. My name is Ananaya. I'm based at Lancaster University. I'm in senior research, as you say there, and as well as all the other groups. Happy to be here.
Oh, thank you, Mizel. And team number 9, young people care, will be led by myself. So now, what I'm going to ask you to do is just introduce yourself and tell us a bit more about where you work, your organization, your workplace. And if you can, tell us about the motivation behind joining this course. So what was your interest in joining the RaCEEs course, or if you have a particular interest in health economics. So I'll start with team number 5, and I'll start with Roisa. Are you there, Roisa? Let me see if Roisa is with us.
I think maybe not.
Or maybe we lost her. Okay. So second person, Alison Bryant.
Hi everyone, nice to meet you all. I'm really excited about this today because I have no background in research and kind of the critical analysis, particularly around economics. And I really want to improve my skill set as an expert by experience public advisor. I'm a public advisor for ARC Northwest Coast, but also for EMRIC, Mental Health Research Innovation Centre in Liverpool. I'm also, because I live with complex and rare health conditions alongside complex mental health conditions, I'm also very passionate about the service user work that I do with the Psychological Professions Network, who are part of the NHS. I write their monthly blog, and I'm really keen to really kind of go with what's embedded within the NHS constitution, which is to ensure that the public are represented across both teaching, training, research, and in meetings like this. So that's why I'm here.
Oh, thank you very much, Ali. That's great. And then I think we got Sandil. I hope I pronounced the name all right. If he's so that Sandil joined before, maybe we lost Sandil. Okay. And then the other person in team number 5, I think, is Rachel, but I can't see Rachel for now. So we'll move to team number 6, and I think we got Lisa.
Morning, everyone. Apologies that my camera's not working. I'm Lisa. I currently work at Liverpool John Moores University, where I head up partnership, a lot of our partnership work, but particularly a partnership between us and the NHS. My background is in the NHS. I'm a nurse by background, but I'm particularly interested. I've been doing some work around sort of housing and health, and the link between housing and health inequalities. So I'm really pleased I'm in the housing group, and I'm kind of, I've never done anything on the kind of economic evaluation side, so I'm really keen to kind of understand more about that and link it up with some of the work that's happening in that area. So nice to meet you all.
Thank you, Liv. Thank you very much. And then we got Catherine. Catherine is here. Catherine Beckett. I can see Catherine, but I don't think I can hear her. Okay, we move to, I hope I pronounced the name right, Ruben.
Hello.
Hello, hi.
My name is Ruben. I work at Lancaster University on a project called the Health Determinant Research Collaboration. And evaluation is a key part of it. So one of the areas that I want to kind of get more into is some knowledge around economic evaluation. So that's why I selected this program, and housing is a key part of the work streams that we focus on. So I thought it would be helpful to be part of this RaCEEs team.
Great, thank you very much, Ruben. And then the last person in this team is Lucy.
Hi everyone, I'm Lucy. I'm a GP in Burnley and the Health Inequality Lead for my PCN. In Burnley, we've at the start of the health and wellbeing partnership with the council, public health, the voluntary community sector, and our project is around the link between housing and respiratory health. So I sort of reached out to ARC because they've always been very supportive of linking with researchers I've always really valued, and they said, oh, there's this opportunity to join this group, and I thought, well, that's wonderful, because I think we're looking at interventions that will make a difference, and so it's really important to look at the economics of that. Not something I have any experience of, but I'm really excited to work with everyone and learn.
Oh, great. Thank you, Lucy. And then I'll move to team number 7, maternal and neonatal care, and we got Bethany.
Hi everyone, lovely to meet you all. I'm Bethany. I'm a senior research associate with the EPIC team in ARC North West Coast that's based up at Lancaster. I've also recently submitted my PhD thesis, which is around health visiting during COVID-19. And after submitting that, I realised I would have loved to have done something health economics with it. So this is the start of my journey, I think, in taking that work forward, hopefully with learning more about health economics. Yeah, so really excited to be here.
Thank you, Bethany, and congratulations on submitting the PhD thesis. That's really a feat.
Thank you.
And team number 7, we got Paul.
Hey, Paul Brain, work for the Health Innovation North West Coast. So we work between NHS, industry and academia to help to bring in new innovations into the NHS. I'm part of the evaluations team. So yeah, looking forward to learning a bit more about health and economics and applying it to our programs.
Thank you, Paul. It's nice to see you. And then we got Manigandan. I hope I pronounced that okay.
Yeah, hi. Yeah, you pronounced that right. Thanks, Valerio. I'm Mani. I'm a neonatologist, consultant neonatologist from Liverpool Women's Hospital. I'm interested in learning about health economics because we've never been taught about any economic thing during our training or during the consultant timing. We only concentrate on health and medical part of it. So I'm zero on economics, how it works, what happens, and how much does it cost to treat a baby and things like that. So it's very interesting to come and learn about it. And I'm also interested that we can publish something out of it as well. So that's a important thing for me as well. So nice to see you all.
Oh, thank you. Nice to see you too. Risha.
Hi, I'm Risha Gupta. Like Mani, I'm also a consultant neonatologist. I'm really pleased to see some people that I've met before on various projects and things. But that's kind of highlighted as a clinician, as Mani says, it's a big gap in our knowledge and skill set. And so I've worked on projects recently, like with Valerio, Andy and Paul, actually on trying to explore how to cost community teams and to prevent readmissions. So that's one area that I'm interested, but I'm also interested in evaluating some of the aspects of healthcare that we do as inpatient and seeing whether innovation for us to deliver them in a different way might be more cost effective. And that's one of the things as clinicians I think we have to be more aware of, and I'd like to understand the skills that I need to be able to undertake that. And I'm really great. It's one of the other things is to hopefully meet other people that I can network and get cross learning from, and it's a really nice group of people. So thank you for letting me come on this course.
Thank you, great. Thank you, Risha. Nice to see you. I just seen a message from Catherine. Thank you, Catherine, for your introduction. That's great. I'm now going to move to team number 8. I think we only got Kamran today. So Kamran, would you like to introduce yourself?
Yes, sure. Good morning, everyone. My name is Kamran and I've done PhD in biochemistry. And I'm teaching in University of Central Lancashire with the School of Medicine and Dentistry. So most of my students, they are interested to go into the medical field. So we really have projects related to the healthcare mostly. And with my background of working in NHS for over 15 years as a data quality person or data quality manager in a trainee GP. So these are the two different aspects where I can correlate that how the economic kind of health economics, how they are affecting, how we can evaluate them. And beside this, I'm working with the other team, other branch of the which is called as the RaCEEs, and I've done few projects with them. So I just thought that yes, I should now jump into the economic side as well to know how, as one of the consultant mentioned that Mr. Mani mentioned, that how the things are working from the economic point of view. So yes, I'm happy that I joined this team. It's really lovely people over here, and hopefully that will help me to learn more things about the economics as well, rather than science.
Oh, thank you, Kamran. That's really good. Thank you. And in team 8, as well as Kamran, we got Mariam, Shabnam, and Alison McLaughlin. So I'm sure we will meet them in the next few sessions. I'm now going to move to team number 9, Young People Care, and I think we got Latif.
Hi everyone. My name is Latif Akoni. I currently a postdoctoral research associate at University of Liverpool. I work in the Health Inequality Policy Research team. Although I have a background in economics and my main interest is more into labor economics, but my PhD looked at the implications or the unintended consequences of economic and labor market policies on health and well-being. So I'm driven more by things around health and well-being of some of these economic policies and announcements we make in terms of welfare benefits, national living wage, and what have you. And I've also had the opportunity during my PhD to do some internship around the ways of doing economic evaluation. So I wasn't trained traditionally in economic evaluations. I'm more into econometrics. So when I saw this, I feel it's key. And the project I'm doing now is an SPHR project on children, young people, and families. And one of the key aspects of it is things around care, both formal and informal care. So I believe this is very good for me. And so when I saw that, I felt it's good. I just also, in addition to the econometrics, to develop my capacity on this so that it can inform the kind of economic analysis that we do in health, in public health especially. Yeah.
Oh, thank you, Latif. It's good to have another economist on board. That's really good. Thank you. And then I think we got Zunira.
Hi, good morning, everyone. I am Zunira, and I'm an Implementation Research Fellow. I work for the NHS at an institute called the Improvement Academy, which is based in Bradford. So as a part of my role, I end up doing a lot of service evaluations, but we are focusing mainly on the qualitative side of things. But I think that thinking about health economic evaluations, that would really strengthen our evaluation. So that's why I was interested in this course. But I do not have any background in health economics. So looking forward to it.
Thank you very much, Zunira. And I think we have RaCEEs now. RaCEEs, are you with us?
Hi, yeah, sorry, I've just had a lot of technical difficulties.
No worries, that's fine.
Yes, I'm a part-time research assistant, part-time coordinator in the medical school, and I'm just finishing my master's in public health at the moment as well. So I'm quite keen on looking into music therapy quite a lot more. So I've done everything from I've done a qualitative metasynthesis, but I kind of want to know from an economic perspective how much things are going to cost and whether it's actually practical to use music therapy long term. So yeah, that's me. Lovely to meet you all.
Thank you very much, RaCEEs. I should say that Team 9, we also got Pooja Saini, who is not with us today, but I'm sure she will join us in future sessions. So just to recap, first of all, thank you very much for introducing yourself and for describing what was your motivation behind joining the course. Just to recap, on Team 5, we got RaCEEs, Ali, Rachel, and Sandil. Team 6, we got Lisa, Catherine, Ruben, and Lucy. Team 7, Bethany, Paul, Mani, and Risha. Team 8, Mariam, Kamran, Shabnam, and Alison. And then Team 9, Pooja, Latif, and Zunira. Okay. So thank you again, everyone. If you got any questions during this session, just feel free to unmute yourself or write in the chat. We will try to monitor the chat as we discuss the content of the session today. Okay. Before we actually move to the actual content of today's session, I just want to delineate the criteria which we're going to follow in order to evaluate if somebody will qualify as a co-author for the final commentary. We decided to follow the criteria set by the International Committee of Medical Journals Editors. You can see the criteria here. I'm not going to go through each criteria one by one, but they're here for reference. And I'm going to say we're not going to be very, very stringent about them, but it's just a reference for each one of us, to be honest, in order to be aware of this criteria and to be aware of what we need to do in order to qualify as one of the co-authors of the final manuscript. So they're here for our reference. Okay, session 1. So the aim of session 1 is to identify a research question and select a suitable economic evaluation. We'll talk quickly about what is an economic evaluation, and then we will talk about defining a research question, talk about the PICO framework, literature search, which is the element that Cath will go through in detail. And then we will talk about the homework, which is about selecting a suitable economic evaluation for the RaCEEs. Now, in pretty much every aspect of our lives, we have to deal with limited resources. So we have to deal with the problem of scarcity. That means we need to make some choices. So we can't spend an infinite amount of time or money in our activities. We need to make decisions. And we got this problem of allocating our resources wisely in the best way that is possible, basically. In the moment we are choosing to do something or to invest £1 in something or 1 hour in something, at that point, we are also giving up something else. So we're not doing something else. So for example, if I decide to spend 1 hour going out for a walk rather than doing some house chores, that's a choice, and we are giving up the value we will get from doing house chores, for example. If we decide to go to a supermarket and spend £5 on ice cream rather than, let's say, wine, for example, we are making a choice there, and we are giving up something. Linked to this problem of allocating our resources is the concept of opportunity cost. Opportunity cost is a central concept, not only in health economics, but in any areas of economics. And it basically reflects the value of the second best alternative you got available, or the next highest valued alternative use of your resources. So if you go to a supermarket and you really want ice cream, but at the same time you really want wine, you go for ice cream, the opportunity cost of wine or the value of wine will be your opportunity cost. And that has got a relevance in every decision we make in our lives. And it's also got a relevance when it comes to choosing an health or social care intervention. So we got a choice between two, maybe more alternatives, and we need to make sure that we are aware of the costs and the consequences of the alternative we are giving up. In this diagram here, you can see the choice between alternative A and alternative B. So you can think about alternative A being a new treatment, like a new drug, a new type of surgery, for example. And you want to understand what is that we are giving up, first of all. Alternative B could be standard care, for example, routine care. And in order to understand what you're giving up, you need to measure the costs and the consequences for both alternatives and compare the costs and consequences against each other. And that's what we are going to do during this course, trying to understand each element, the cost, the consequences of the outcomes, let's say, and how we bring everything together in a comparative analysis. And this is the typical diagram of an economic evaluation. Of course, you might have more alternatives, maybe 3 or 4 alternatives, but at the end of the day, this is a typical simplified example of an economic evaluation. Any questions so far? Okay. Now, I'm going to ask you now to take a minute and try to write down a particular research question you got in mind. So what we're going to discuss now is try to formulate a research question and then try to understand how we can look for potentially suitable economic evaluations around your interest or your particular research question. So take a minute, write down your particular research question you're interested in, and then we'll discuss some of these research questions later on. Okay. Is somebody very, very brave and can unmute himself or herself and tell us a bit more about the research question you got in mind? Any volunteers?
I don't mind going to get the ball going, because Valerio is a question that I think has puzzled us and we've not quite got to the bottom of. So mine is really around the cost effectiveness of care delivery in the community for high-risk newborn babies versus inpatient hospital care. That's the broad kind of theme. And in specifics, I suppose if we're looking at I suppose a PICO approach, or looking at the population, which population am I looking at specifically? I'd be looking at how would I reduce the length of stay for babies who are currently on, I suppose, postnatal wards, transitional care, special care settings in hospital, who are stable. How can we reduce their length of stay and therefore the inpatient costs by providing that care in a community setting? So, you know, how would that be? You know, I think in terms of reducing all, improving patient care, well-being, reducing health inequalities, all of those things are things that are very difficult for us to quantify and evaluate in terms of their pounds, how much that contributes to the economy. But actually, you know, I think that's something that would be helpful to understand alongside the reduction of the actual sort of, you know, how much does it cost for a bed per bed day per patient kind of things, because that argument doesn't seem to weigh up. Whereas if you look at potentially adding in all of the costs that are currently incurred to families and people by, you know, the additional hidden expenses that they have, that's the sort of thing that I think might actually help us understand better the cost effectiveness to the NHS, to the system, to society as a whole, much better. But so that's one of the areas that I'm interested in, as well as the flip side of, if community, you know, using it in the community care, is that going to have a negative impact of increased readmissions onto paediatric wards? So my balancing would be to make sure that we are actually measuring whether there are any readmissions as a consequence, and potentially actually extending the service to babies that are currently being readmitted within that period with similar conditions, so that we're in a way also reducing the burden on the acute paediatric services for these babies. So it feels fairly complex, but I think there are very kind of key themes to it, where there's a lot of overlap, where if we understand those mechanisms better, you can be able to, I suppose, refine the research question a little bit to be more sort of straightforward, I suppose.
That's really good. Thank you. That's a really good example, Risha. Thank you very much. If others have got other research questions, feel free to write them in the chat. Actually, Ali, do you want to tell us about yours? Yeah.
Thank you, Valerio. I found it really hard because I'm trying to get my head around the fact that I'm writing a question about music therapy and I'm thinking about the cost and the economics, but then also I don't want that to be at the cost of the question addressing this particular target around mental health. So I got myself tied up into knots. So what I wrote was, is music therapy cost effective in reducing symptoms of anxiety in people 18 to 30 in comparison to using Silver Cloud whilst being on the waiting list for talking therapies? Because I'm really aware of the impact on functionality, productivity and quality of life on waiting lists that keep being extended all the time. And obviously for young people in that kind of age group 18 to 30, it's such an important time to have targeted therapy that is really useful and productive. So those comparisons of, you know, kind of the use of something that already exists, that's already been costed in, as opposed to something that hasn't been costed in, and actually seeing those kind of comparisons across this group. But as I say, I don't think the way I've written the question is right, but I think really looking at those economic costs in relation to the personal costs to the people who are actually on the waiting list was kind of where my head was.
Oh, no, that's good. That's good. Thank you, Ali. So, as I was saying, like, you can write down your research question on the chat. Feel free to do so. And just to give an example, I mean, we had a very good example from Rishi and Ali. This is an example we came up with. It's a physical exercise program, cost-effective in improving cognitive function for patients with stroke. So you can already see it's an economic question because we got the word cost-effective in that. Risha mentioned the PICO framework before. For those of you who never heard about the PICO framework, PICO stands for Population, Intervention, Comparison, and Outcome. And it's a framework which helps us basically finding the building blocks of a research question. And I will show you what I mean with that in this by looking at this table. So consider the example research question we got there. The population will be adults with stroke. The intervention we're looking at is physical exercise program. Comparison or comparators, we don't really have any comparators, so we can leave the cell blank. And the outcome is cognitive function, sorry. The outcome is cognitive function. So these are our building blocks. And in order for us to find a suitable economic population out there, we need to think about search terms. So similar terms or umbrella terms, for example, that are related to the population, to the intervention, to the comparison and outcome terms. For example, stroke, you can think about cerebrovascular disease. Physical activity, exercise is a similar term. Cognitive, you can think about cognition, for example. So these are all similar terms which will help us formulate and setting up our search strategy a bit better. Now I'm going to stop sharing this presentation, and Cath, you want to go through the literature search?
Yes. Share my screen. Oops. So as Valerio said, in order to construct our search, we need to think about some search terms, as he's outlined. So then, once we've decided what search terms we're going to use, we need to put these together in to a search string. So there are more than one way to conduct a search. There are more advanced techniques that we can use, but today we're going to keep things really simple. And we're going to look at putting together a search within just one search string. So in order to build our search string, we need to know a few things about how databases operate. We're going to use what we call Boolean operators. It's just really a fancy term for the instructions to tell the database how to connect our terms together. So the main Boolean operators are or and and. So or tells a database to search for either or any of the search terms that you type in. So for your synonyms, for your alternative terms for each concept, you will use or, so stroke or cerebrovascular disease. And this will ask the database to return abstracts that have either of those words within the abstract, because we want abstracts with either of those terms. And tells the database to search for both or all of the search terms. So we will use and to connect the concepts together. So stroke and physical activity, because we want abstracts that have both of those terms within the abstract. Now, when you conduct a search using a single search string, you need to use brackets to tell the database how you want the search to be executed. So it is a little bit like a mathematical equation. So we need to have brackets around each cluster of terms. So for each concept, we want brackets around those terms using or. And then between each cluster, we'll have and it'll make more sense in a second when we have a look at the actual search string. But it's very important that the brackets are in the right place. Otherwise, the search won't be executed as we want it to, and we won't get the search terms that we'd hope for. The search results we'd hope for. One last thing, we've also got a bit of information about quotation marks. So quotation marks tell the database to retrieve results that contain an exact phrase. So this only applies if you have a search term that has more than one word. If you're just searching for one word like stroke, you don't need to use quotation marks. However, if you are searching for cerebrovascular disease, you might want to put quotation marks around that so that it will return that specific phrase. So for example, chronic obstructive pulmonary disease, if we put bracket quotation marks around that, it will return results with that exact phrase within them. If we don't use the quotation marks, most databases default to AND, so we'll still get some relevant results, but we might get many more irrelevant results because the words could be anywhere within the abstract, not necessarily as a phrase. So I hope that makes sense. So putting it together in a search string, this is what it will look like. So we have stroke or cerebrovascular disease. That's our terms. Those are our terms for stroke. Those will be in brackets. Then we have and physical activity or exercise, again in brackets, because that's a second concept, and cognitive or cognition. And then we have some terms here as well for costs and economic evaluations. We're hoping, obviously, to find an economic evaluation. So these terms will help us to narrow our search down, hopefully, to economic evaluations and cost effectiveness studies. So we have and cost or price or expenditure or expense, and economic evaluation or cost effectiveness. And we'll post those terms in the chat of your team's sites so that you can copy and paste those into your search when you come to do it. So I hope that all makes sense. Are there any questions at this point? Okay, so we're going to look at doing a search on PubMed. So PubMed is a platform, a database platform. It is produced by the National Library of Medicine in the US. And it contains the Medline database, which is probably the main medical database covering medicine and health sciences. PubMed also contains some other indexes for life science and some online books. And happily, it is completely free to access, so everybody can access this. If you just Google PubMed, or you can see, I think there's a link within the slides. You'll be able to access it. So from the homepage, this is the homepage, very simple. There's a basic search box on the homepage. So what we can do is I will just copy and paste our search string in, and we'll just go through that again. Hopefully it's clear. So in one big long search string, we have stroke or cerebrovascular disease, and physical activity or exercise, and cognitive or cognition, and cost or price or expenditure or expense, and economic evaluation or cost effectiveness. And then what we'll do is we will click search. One other thing to mention, I've got all my ors and ands in capital letters, but actually it doesn't really matter on most database platforms. The database will recognise them even if they're in lowercase as being a Boolean operator. So these are our results. This is the results page. We can see we've got for this search just 14 results, which is a nice small number. The results are displayed in a list here. They're sorted, we can see, by best match, but you can change that to the date if you want. And down the left-hand side, we have some further filters. So if we want to filter the results, there are a few other options to do that. The main one that will be useful to us is the publication date. So ideally, we would like to find an economic evaluation that has been done in the last 5 years. If you're really struggling, or you find the absolute perfect paper that's a little bit older than that, that should be okay, but we don't want anything, definitely don't want anything older than 10 years. So what we're going to do is we'll just filter, we'll click on 5 years, and that will filter our results to the last 5 years. So now you can see we've just got 5 results. So now we've got the list, and if we click on one of the results, the first one on the list, we can view the full abstract. So again, worth mentioning here, when we search most databases, including PubMed, Medline, we are only searching within the title and abstract and indexing. It's not searching the full text paper. And that's the case for most databases. So just to bear in mind. You need to think about what terms are going to be really important and what terms are going to appear in the abstract when you're thinking about what to use for your search. So it can be a little bit difficult to spot economic evaluations. Although we've got terms for economic evaluations in our search, there is a good chance that other types of papers that mention these words will be returned as well. There's no perfect search, unfortunately. So I'm just going to go through our 5 results just to show you what types of papers might be returned and which papers are going to be most useful to us. So this first result actually looks like it's spot on for our question. If we have a look at the objective section, it's to conduct a cost effectiveness and cost utility analysis. So it's definitely an economic evaluation. Those are economic evaluation techniques. The title is Economic Evaluation of Exercise or Cognitive and Social Enrichment Activities for Improved Cognition After Stroke. So it fits our population, it's the intervention we're looking for, and it is definitely an economic evaluation. So this one looks pretty good, but let's have a look at what else we've got on the list. Our next result looks quite promising. It's talking about clinical and cost effectiveness of a personalised health promotion intervention. Population isn't quite what we're looking for. It's older people with mild frailty. But if we look at the rest of the title, this is actually a study protocol. So a study protocol or a trial protocol is a plan of what they're going to do in the trial. It outlines their plan for the trial, who they're going to try and recruit, what they're going to do, what techniques they're going to use. It's not actually got any results within the paper. So this would not be useful for us. This wouldn't be an appropriate paper to use. Our third result, if we have a look, this, again, it's talking about economic evaluations, but if we just read the objective, it's actually a paper about quality adjusted life years and using quality adjusted life years to capture the impact of different diseases. So it's not actually in itself an economic evaluation, it's more about economic evaluations. It's more of a methodology paper. Our fourth paper, again, looks quite promising, economic evaluations of physiotherapy. However, this is a systematic review. So unfortunately, we don't want systematic reviews for our RaCEEs projects. Systematic reviews look at all the evidence on a particular topic and all the studies that have been done on a particular topic, but it's a different methodology, it's a different focus. It's looking at the sort of secondary research, it's a secondary research type rather than what we're looking for, which we would be looking for a primary economic evaluation, if that makes sense. So if you see a systematic review, unfortunately, that won't be useful for us for this project. And then finally, our last result, development of strategies to support home-based exercise. It's actually a Delphi consensus. If we look at the objectives, it's not actually an economic evaluation. It doesn't mention that in the objectives at all. It's actually a sort of a consensus where they get loads of experts together who decide what they would recommend on a particular topic. And it just happens that they mention cost effectiveness in the conclusion. It's not actually in itself a cost effectiveness study. So if we want to return to our search results, there's just a link towards the top right hand corner and we can get back to our list of results. So I think for this one, our first result there, that would be our best bet. And what we would then want to do is try and find the full text paper and read through the full text and just check that it's a good study that we would want to use. In the top right-hand corner here, there are some links to the full text. Now, in this case, it's an open access publication. So we can just click on this link and it will take us to the publisher website and we can download the PDF from here. It might be that the paper is behind a paywall that you require a subscription to view it. If you work for the NHS or for a university, there's a good chance that you'll have access to a lot of subscriptions. If you use your Open Athens account, or if you contact your library, they'll be able to help you access that. However, if you're struggling to access any of the papers, or you don't have access to a library and subscription resources, if you just let us know, we'll try and help you, and we'll try and get hold of the paper for you. Okay. Go back to slideshow. Okay. Are there any questions about that before I move on? Oops, sorry.
Sorry, Latif, just a quick question from me. So I saw that we just went through the PubMed. Maybe I wasn't listening enough. Is that the only library you would recommend, or you can explore the libraries as well?
You can definitely explore the libraries as well, and your search string should work in most databases. So if you have access to other databases, you don't find anything through PubMed, yeah, definitely try other databases that you've got access to. Yeah.
Thank you.
Absolutely. We've just picked PubMed because everyone will definitely have access to that. But yeah, if you have other databases you're more familiar with, yeah, do go ahead and use those. Sorry, I'm just going to reshare my screen. Are there any other questions from anyone? Okay.
Can I just ask, Cath, sorry, or Valerio, whichever, as part of this project, I mean, I'm hoping that most of us will want to be writing this up. Presumably then our search strategy will form part of the methodology. So we need to be kind of collating that as we go along.
No, not for this project. We don't tend to report how we found the paper, because we're only going to pick one paper. So, but there's no harm in keeping a record of what you did. And that's always good practice to, when you're doing research projects, to make sure you keep a note of how you found things. So there's no harm in doing that. But yeah, we don't tend to report our search as part of the RaCEEs project. Is that correct, Valerio?
Yes, that's correct.
So running your search, just a few final points. You might find when you run your search that you get thousands of results. So if you do find sort of more than about 100 results, more than you're comfortable or have time to look through, you could try adding some additional concepts to your search. So for example, if you've only searched for the population and intervention, you might want to include terms for the outcomes you're looking for specifically. If you're looking for a specific comparator, in our example here, we were just looking at usual care or any comparator, so we wouldn't want to have terms because there would just be too many sort of variables. But if you were looking specifically, for example, physical exercise interventions versus antidepressants, you might want to add some terms for antidepressants as well as physical exercise, if that makes sense. Again, to make the search more focused, you could remove some of your synonyms. So if you have lots of different terms for the population, you might want to take out some of the less focused terms. So for example, rather than searching stroke or cerebrovascular disease, you could just search for stroke, which is the more commonly used term for that condition. If you don't identify any relevant economic evaluations after your first search, you might need to broaden your search a bit. So you could remove one of the concepts. So if you have searched for population intervention and outcomes, you could take out the outcomes term and just search for the population and intervention. Sometimes outcomes are not very well reported in abstracts. So in order to broaden the search, you can take out sort of an element of it. You might want to add in some extra terms, some further synonyms, maybe to capture other literature. As we mentioned, if you have access to other databases, you can try other databases to see if they contain any further papers. However, there is a chance, just to warn everybody, that there may not be an economic evaluation that has been done on your specific topic. So if you've got a very specific topic in mind, there is a chance that there won't be an economic evaluation that has been published. So you might just have to adjust your research question and perhaps look at something slightly different. Okay, I think that is my part over. Does anyone have any questions about the search? Well, if you have any questions, if you just post them in to Teams, or you can email me directly. I think my email address will be on the slides. Yeah, I can help you with any questions as you come to do your homework.
Oh, thank you, Cath. So I'll share my screen. Thank you very much, Cath. So once you got all the results, you can then choose what will be your best economic evaluation, as Cath was saying before. You can read through the abstract. If you're still struggling, maybe you got 2 or 3 economic evaluations which look very good, you might want to look at the full text. If you struggle to find the full text, as Cath was saying, feel free to contact us, and we will be happy to help you. And if you struggle, these are some criteria. I'm gonna leave them here so you can go through these criteria that might help you in terms of selecting the best economic evaluation. It's not an exhaustive list, it's just some criteria that will guide you through the selection, okay? Now, in interest of time, I'm just gonna talk about the homework now, and then if you got any questions, we can stay for another 5 minutes at the end of the session. Just gonna talk about the homework. So the homework will be for each one of you to search and select a suitable economic evaluation based on your team topic, of course, on PubMed or other available databases. So that's your first task. The second task is to write down the title and paste the link to the economic evaluation or Word document on Teams, which I will show you in a second. And we are going to ask you to complete this task by next Monday. We will remind you during this week. Here is how you can access the document on Teams. So you will go on your team space for your specific RaCEEs team. You can select session 1. And then within that folder, you can find the document, which is called RaCEEs Session 1 Homework. You open the document and you will see your name at some point in the document, and you can just write the title of the economic evaluation you found and then copy and paste the link to that article. Task number 3 is to then look at the economic evaluation chosen by the other members in your team and vote for what you consider the best economic evaluation. And we're going to ask you to do that by next Friday, Friday the 15th of November. So next week, you'll have a chance to go through the different economic evaluations chosen by your teammates and try to vote for the best in your opinion. You can't vote for your own, but you can, of course, vote for somebody else's economic evaluation. If the team leads see that there are not enough papers, we will then add some papers to the pool, okay? So in order to avoid that, it's important that each one of you does the homework and select an economic evaluation, so you can basically choose within the pool which has been selected by the team members rather than the team leads. So if you want to avoid us choosing an economic evaluation for you, just take some time to do the homework this week if you can. If you need more time, let us know. That's not a problem at all. Okay. At the end, by the end of next week, the team leads will double check the economic evaluation for each team, just in order to make sure that it's of good quality, of decent quality, let's say. It doesn't need to be extraordinary quality, but it needs to be of decent quality. Because at the end of the day, we don't want you to work on something really bad for the next few months, right? So we will make sure that the economic evaluation is of decent quality. That's it from us, and sorry for running a bit late, but I thought it was very good to spend some time introducing ourselves and to get to know each other, because we will work together during the next few months. If you got any question about this session, you can email me or Cath. I'm going to stop the recording now, but if you got any questions about what we discussed, we are more than happy to stay online. Otherwise, I just want to thank you for attending today's session. It's so great to see so many of you today, and we'll see you on the 18th of November. Thank you very much.